Hello, everybody. Dr. Dominic here, and I want to talk to you today about indications or times to get a facelift. I'm smiling because it's fairly subjective, and a lot of patients come in thinking they need a facelift. I'd say from a chronologic age standpoint, most patients are getting facelifts towards their late 40s, going into their 50s, and certainly in the late 50s and 60s and on. And the reason why, as people age, we tend to develop laxity. And the laxity that's more common to develop that we get is normally along the jawline, and then you start to get what we call jowling. That's where a facelift comes into play to help tighten that area up and make it look more refined and defined. Oftentimes, with a facelift, you'll be combining a little bit of liposuction as well if you have a little bit of fat, or in medical terms, adiposity in this submental area. One of the questions that I've encountered over the last 15 years of my practice is patients inquiring, quote, are they too young for a neck lift or facelift? And there's really no hard line, answer for this to say yes or no. There's a lot of subjectivity. I would say that doing a facelift on somebody who's younger than 40 is very uncommon. A neck lift is something that's more common in people who are younger than, let's say, 40, because many times patients will still have that definition on the jawline. They don't have a lot of jowling, but you can have some laxing in the neck area as well as some adiposity, which could need to be addressed with a neck lift. One of the questions that I get is, in this day and age, we want to have minimal surgery and maximum improvement. So many times patients will come in wanting to know, can they just have a neck lift or can they have a mini lift? And I see this often in my patients, whom are, don't take any offense, older. And what I mean is, people whom are 55 and older tend to have a little bit more laxity in the skin. And when they inquire about a neck lift in that age group, what can be difficult is if you have a lot of laxity and you try to tighten up the tissues below it, what happens is that skin laxity will tend to become redundant and you get some pleating here. In those situations, I try to talk to patients about thinking about doing more of a facelift, because if you're going to do one procedure and you're 50 plus from an age standpoint, I would tend to tell patients to favor doing a facelift versus a neck lift, because if there is any excess skin, I think you get a better result with a facelift than doing with a neck lift. Whereas on the flip side, if you have somebody who is, let's say, I'd say 40 and younger, if they want to get a little bit more definition along the neckline, I think that's where a neck lift is a better procedure than necessarily having to do a facelift. And a lot of that has to do with the skin. In the younger age group, when our skin is a bit more elastic and more youthful, it tends to contract better and it layers out much more smoother. I think the perfect example of this is doing liposuction, somebody who's 20 years old. You have a really good elasticity and you want to address some of the adiposity. When you remove that excess fat and you create a dead space there, the skin will tend to tighten up and cinch up, and it layers out much smoothly compared to somebody who's in their a higher age group, 50 plus, for instance. Now, in the other part of what's going on in our society and medically is people are losing weight. And part of that is facilitated by pharmacologic meds, also people taking interest in themselves, eating better, working out. And so if you have extremes in weight loss, you can develop a lot more laxity at a younger age. And that is something that I think is can become more prevalent as people lose significant amounts of weight. I mean, we're talking 30, 40, 50 plus pounds. And that's where you can have excess skin. And that too could be addressed with a facelift. But for the most part, when you're talking about a facelift, you're talking about addressing this part of the face, what we call the upper and the lower part here, or the lower part here of the face and the upper part of the neck. Now, oftentimes patients have a misperception because when they think of a facelift, they think of an incision going from stem to stern all the way up and around, elevating the brow and everything, and they get a little bit overwhelmed and a little bit scared. A facelift incision is normally going to involve making incision up here in front of the sideburn area for women, and then normally follows the contour of the ear, comes behind the ear lobule, goes behind the ear into the hairline. Now, for men, we normally can bring the incision up higher here in the temporal area. And the reason why is we have hair-bearing skin that can be pulled up, and so it won't distort this area as the hair grows back. Whereas in females, if you bring the incision up here and you pull non-hair-bearing skin into this zone, women can get what's called temporal balding, which doesn't look good, obviously. So we've modified that incision over time to come in this area here in the sideburn for females, so that way the incision can be camouflaged. Another difference between men and female facelift is with women, we tend to adhere very tightly around the ear lobule, for one, to maintain that ear lobule shape, and then for two, to camouflage it. Whereas in men, we can tend to bring the incision a little bit below that because of the hair-bearing aspect, and because we don't want to pull the beard up underneath the ear lobule, because then it'll become very difficult to shave if you desire to do that. Now, oftentimes patients come in asking about, a facelift versus a neck lift. There's a lot of overlapping with the terminology. In my practice, when I'm talking about addressing the neck, I'm normally talking about this central area here. There's a muscle called the sternocleidomastoid, and we're kind of addressing this central area between these parts of the muscle. And what we're trying to do in that situation is address bands. So as we age, you can start to develop bands, and you can see these here in my neck. But as we age, they can become a little bit lax. And so what you're looking to do is tighten those up. So when you're doing a neck lift, you make an incision underneath the chin in this area here. And normally there's a natural crease that we all have between the chin and neck. So it's a nice place to camouflage it. But that allows us to tighten up those bands and redrape the skin. Now, I'm sure some of you are wondering, can you combine a neck lift with a facelift? The answer is absolutely. So I've had plenty of patients who often do a neck lift with a facelift. Do you have to do both at the same time? No, it's really up to you as the patient. So I hope this sheds some lights on, a facelift versus a neck lift. If you have any questions or comments, feel free to include them at the end of the video. We'll try to help you out with them. Have a great week.